Hello everyone, welcome back to our channel. In today's video, we are going to talk about something super important for your OET speaking test. You know what is that? It's clinical communication. Now I know what you might be thinking. Clinical communication? That sounds kind of boring. But hold up, let me stop you right there. Clinical communication is not just about speaking to patients or colleagues. It's about creating real connections, showing empathy, making sure that information gets across clearly and with care. After all, when you're in a healthcare setting, communication can make all the difference. In this video, we are going to break it down, have some fun with it, and you will walk away feeling like a pro communicator ready for your OET speaking test. So let's jump in. First off, let's define what we mean by clinical communication. Simply put, it's just the way you interact with your patients, colleagues, and other healthcare professionals. But it's not just talking. It's about how you listen, how you show empathy, how you deliver medical information in a way that people can understand, trust, and feel comfortable with. And we have few key elements when it comes to clinical communication. The first and foremost thing is empathy. You need to be able to connect with the patient emotionally, especially when they are dealing with any kind of stress or anxiety. And the second one is clarity. The way you deliver medical advice is key. If it is too complicated, they won't understand. And if it is too simple, they might not take it seriously, right? So remember, it is very important what way you're going to deliver your medical advice. And the next one is active listening. Here, you are not just speaking, you are hearing what the patient or your colleague is saying and responding in a way that shows you care for them. And when it comes to professionalism, whether it's with a colleague or a patient, your tone, body language, and word choice should always reflect the professional setting you are in. Now, why does clinical communication matter? Well, imagine you're sitting in a doctor's office. You're nervous because you don't know what's wrong with you, and your doctor walks in, speaks too fast, uses very complicated medical terms, and he is not explaining anything clearly. Not only would you be confused, but you would also feel even more stressed out. On the flip side, imagine the doctor who speaks very slowly, explains clearly, and he's showing empathy for your worries and make sure that you are comfortable. Then you'd feel reassured, right? So, in healthcare, how we communicate can change outcomes, whether it's giving clear instructions, offering emotional support, or making sure everyone on the team is on the same page. Clinical communication is the heart of everything. All right, let's break down how clinical communication actually works in real scenarios. I'm going to show you two examples, one with patient and one with colleague. So here is scenario one for patient communication. Imagine you are a nurse explaining post-surgery care to a patient. So, first one is active listening. When the patient says, like, I'm a bit worried about the pain after I go home. I don't know what to expect. So, here you should show empathy and reassure the patient that everything will be fine. You can say like this: I completely understand how you're feeling. It's natural to be concerned about pain after surgery, but don't worry, we have a clear pain management plan in place, and I'll make sure you have all the medication you need. If the pain gets worse, just give us a call. And do you know why does it works? You are here acknowledging the patient's concern. You are giving clear information about their pain management and reassuring them. And you also notice the tone. It's very calm, friendly, and confident. And there should be some clarification. Right. You have to ask, or you have to say, like, is there anything specific you're unsure about, or you like me to explain further? Here, you are giving them the chance to express any additional concerns and always try to close with a positive, reassuring note. You are going to do great. We will take care of you every step of the way. Any other questions? So, here you are ending on a positive, reassuring note showing that you are there for the patient. So, your support will be there with the patient. Got it? And let's see one more example for professional communication. This scenario is a professional communication between two colleagues, a doctor and a nurse discussing a patient care. So the first one is like active listening. The nurse says like this: I noticed that Mr. Johnson is experiencing some discomfort after his procedure. He seems to be in a bit of pain. Now, you have to say like this. First, you have to listen actively to the nurse, what the nurse is saying, and after that, you can say like this: Thanks for letting me know. Let's adjust his pain medication. I'll prescribe something a bit stronger to keep him comfortable. Why does this work? Here you're acknowledging the nurse observation and you're responding in a very prompt and professional manner by giving clear instructions. And you should ensure understanding. You can ask or you can say, like, can you also monitor his vitals closely for the next few hours? If anything changes, please update me immediately. Here, you are very clear about the actions needed and you're asking the nurse to update you. You ensure that both of you are on the same page. Okay, so this is how you need to communicate in a professional setting with a patient or with your colleague. Let's discuss some of the common pitfalls in clinical communication. Okay, so this is your time to learn from the mistakes others have made so you don't make them yourself. Overloading the patient with information. You might want to give a patient all the details about their condition, but remember, less is more. Break the information into digestible pieces and only give as much as they can handle at that moment. Don't give too much. The next one is speaking in medical jargon. It's tempting to use medical terms to sound professional, but if the patient or colleague doesn't understand, then it's of no use, right? So always simplify whenever it's necessary. Try to use simple terms and communication. If you are not listening enough, then it will be very difficult, right? Communication means it's a two-way street. Don't interrupt the patient or colleague when they are speaking. You have to show that you are listening by using body language, eye contact, and words like I understand or tell me more. Simple, right? And that's all for today's video. If you found this video helpful, don't forget to hit that like button, share, subscribe, and click on the bell icon so you don't miss any future videos. See you in the next video. Bye for now. Bye bye.